pediatric optometrist here at Conestoga Eye, and today we're going to talk about myopia management. Myopia is a condition by which the eyeball elongates further than what would be normal. So most children, as their bodies grow, their eye will lengthen, but with myopia, the eye lengthens further than what is ideal. And that causes a blurred vision at distance. It's also sometimes called nearsightedness or short-sightedness. Myopia management is when we use active treatments in order to reduce the elongation of the eye so that children can become less nearsighted. There are a number of treatment options for myopia management. One of them is a specialty designed contact lens that has treatment zones that helps to shift the light as it hits the inside of the eye, and that helps the eye not to think that it needs to grow longer, so it keeps the eye at a more stable size. The second option is what's called diluted atropine, which is an eye drop that's placed in the eyes every night. The eye drop also works to change some structures inside the eye over time, some relaxation of the focusing muscles and things like that that also help to reduce the lengthening of the eye over time. A third option, which we hope will be on down the pike here in the next year or two, might be specialty designed eyeglasses, which are not yet available in the United States, but we're hopeful for them in the near future. When you come for a myopia management consultation at Conestoga Eye, you'll initially come for if you're a new patient, a complete full exam. After that, if we agree that you're a good candidate for myopia management, we would do what's called a myopia management baseline visit, where we do some measurements including pupil sizes, focusing ranges. We measure a baseline length of your eye so that we can make sure the treatment is effective, and that sort of thing. Once you begin one of the treatments, you're typically, within the first year, seen about 5 times, usually about a week, a month, 3 months, 6 months, and then at the year mark. If everything is working well for you at that point forward, typically you're seen about every 6 months. With myopia, even small amounts, we have found that a risk can be increased later in life for certain eye diseases like cataracts and glaucoma, some maculopathy, which can be detrimental to sight in the long run. And so really my feeling is that any child that has myopia might be an excellent candidate for myopia management. So it's always worthwhile to come and see if there's any myopia present at all, or even if there's a family history of myopia and you're not sure if your child has myopia. You'll find that myopia management treatment is a little more expensive than standard treatment. Some of that has to do with the extra visits that are required, especially within the first year, but even subsequently. And currently, not all insurances will cover active myopia management. This is something that may change in the future. But because of that, there is a bit of an increased cost, regardless of whether you choose the contact lens or the eye drop. But in the long run, as it will likely reduce concerns down the road, it can be an excellent investment.